Welcome to the Anxiety Coaches Podcast, a relaxing and informative show where we explore anxiety, panic, and PTSD, sharing how you can overcome them for life.
Aloha! Welcome back to the Anxiety Coaches Podcast. I'm your host and coach, Gina Ryan, and I am so happy to be with you again today as together we can consider the many ways to bring your mind and body back to its natural peace and calm. In today's episode, I'm talking about common medications that may be triggering your anxiety. I had a listener send in a voicemail, which I was really happy to receive because she brought up an excellent point. So I immediately jumped on it and decided to talk to all of you about this whole idea of medications and anxiety. And our listener, Karen, wrote, "Hi, Gina. I'm a longtime listener and I've written to you a few times, but this is just a really quick note to say I was listening to episode 896 about tremors and shaking, and it reminded me that I had taken cough medicine at one time a couple of years ago, and it prompted the worst panic attack I've ever had. Plus, I had shaking all within my body. I even told my husband it felt like my insides were shaking. So I just wanted to say this because I don't know if you've done an episode about over-the-counter medications and the effect they have on anxiety. I know you're not a medical doctor and don't claim to be, that's right, but I thought this might be a topic that you could look into more, or maybe you already have. Anyway, gotta go running to work, but have a good day and thank you for all you do." And again, that was from Karen. Thank you, Karen, for sending that voicemail in. I didn't play the recording. It was a little crackly. So I am thrilled that you mentioned this because this actually happens a lot. And we are remiss to not bring up the fact that medications can be playing a big part in some of your anxiety. So we already know that this condition that we have, this anxiety that is ongoing, not just here once in a while, can be caused by all kinds of different factors. And that includes medications. But the medications can be easily overlooked. Obviously, I have not talked about it. Understanding which medications can trigger anxiety can help you better manage your symptoms and find relief. Today's episode provides an overview of common medications that may trigger anxiety. Now, Karen, her voicemail question was about over-the-counter medications, but I'm going to expand it a little further and include common medications that are both over-the-counter and commonly prescribed. Sometimes we need to look at our environment and what might add to our symptoms and sensations. We can be doing our best to keep our nervous system in tip-top shape so that it can handle the slings and arrows of everyday life. But if we are not aware of it, we could be experiencing anxiety-like symptoms and sensations from substances we are ingesting. In today's episode, I want to look specifically at medications that might be the culprit. Anxiety is difficult to manage at times, especially in the early days. Those of you who are new to the show or who are just learning about your own body and mind in this state that we call anxiety, it can be difficult. There's a lot to be thinking about and managing in the early days. And if you are there, just rest assured you're going to get a handle on it just like everyone else. And now you have the benefit of hearing about medications that could be playing a part in your anxiety as well. A number of factors can cause us to have those types of anxious symptoms and sensations. And again, medications are one of those factors that are commonly overlooked. Many times, medications are taken without a clear understanding of the side effects that may be encountered. Therefore, a connection is not always made between the anxiety that you're experiencing and a medication. So let's look in the medicine cabinet, so to speak, and see if there could be some anxiety triggers lurking in there for you. Certain medications can worsen or even cause anxiety, especially if you have been diagnosed with an anxiety condition. If you are having trouble with these symptoms and have ruled out other causes, it might be a medication that is adding to your stress burden. So let's go through them. And this probably isn't even all of them. I am just covering the common ones. And the first one that I have is steroids. Steroids are used for various conditions and infections that cause swelling, like inflammation or rashes, and they are notorious for their long list of side effects, including things like stomach upset, high blood sugar, immune system effects, and so forth. But one of the possible side effects is anxiety, and it's often seen when taken high doses of steroids. And when the dose is lowered too quickly or when they are stopped suddenly, then we can have this side effect of anxiety. In fact, research suggests that the dosage you're taking is the most important risk factor for developing the anxious side effect, with higher doses putting you most at risk. And just to know, steroids come in tablets, liquids, inhalers, sprays, and drops. So it doesn't matter how you're taking it in, the steroids could be causing your anxiety symptoms and sensations. The next one is caffeine. Need I talk to you about caffeine? Well, because it's in a lot of medications, I'm going to talk about it again. Many medications contain caffeine. And if you're a regular listener here, you know the havoc caffeine plays on our nervous system. Caffeine is a stimulant. Sometimes it can make you jittery, very jittery. We experience this sensation when we have too much caffeine from things like sodas and coffees and energy drinks, but caffeine boosts alertness, brain function, and heart rate, and that's why people take it, right? In those drinks that I was just mentioning, in the sodas, the coffee, and the energy drinks. But it can lead to feeling anxious from the alertness, the brain function, and the heart rate being increased. Eliminate it while you are healing your nervous system. That's all I ever say. Eliminate it if you can. Now, we're talking today about it being in medications. So besides being in multiple different kinds of beverages, caffeine is in several medications, including over-the-counter diet pills, headache remedies like Excedrins, and then it's also in prescription medications because many are combined with caffeine for things like migraine medications. So ask your pharmacist for more information about the medications you are taking. Because if you are sensitive to caffeine, which most people who are in an alert, anxious state are, you want to be eliminating this wherever you can. Now, the next group I have to talk about is the decongestants. These are often ones that we would get over the counter. Nasal decongestants are medications we take for like a stuffy nose or sinus headache or bad allergies. These are things such as Sudafed. These medications work to clear nasal passages and help people breathe better. This is interesting because in our bodies, These decongestants look very similar to stimulants and can have the same side effects, including anxiety. Now, decongestants can be found in a variety of over-the-counter medications. Several cough and cold products contain a decongestant along with a cough suppressant and an antihistamine or a pain reliever. And this very well may be what our listener Karen was experiencing when she had the worst panic attack of her life from a cough syrup. She may have been experiencing the side effects of the decongestants. These decongestants can also be found in over-the-counter nasal sprays such as Afrin. This is another group of medications where it's really important to check the label or ask your pharmacist for help in selecting a medication. Because when you are sick already, the last thing you want is now to be feeling like our listener Karen was feeling, shaking from head to toe, shaking on the inside, and having that trigger your anxiety and send you on a trip down the wormhole on top of already not feeling well. Now, there are some more medications. That's the antihistamines. Antihistamines often go hand in hand with the decongestants, and I'm not sure what our listener took, but it could have had a whole bunch of things in it, which many cough combinations have. These antihistamine medications are used to dry up runny noses, calm itchy eyes and skin, and relieve other allergy-type symptoms. Several different types are available over the counter. These are things called Allegra, Zyrtec, Benadryl, Claritin, and others. Some of these names might be familiar to you, and like I said, let's look in that medicine cabinet and see if you are taking layer after layer of anxiety triggering medications. This could be a clue, a place that you can follow a little bit, see if these medications could be eliminated and how your mind and body might react to that. And another point about the antihistamines is while most people expect antihistamines to cause drowsiness, and many people will take it for that. You hear of people taking Benadryl quite often to try to calm them down and fall asleep, but this isn't always true. A number of people who take them experience a faster heart rate, trouble sleeping, restlessness, and anxiety. Again, we want to check and see if we absolutely have to take these, if they are causing us this much distress, and talk to your healthcare professionals and your pharmacy technician or pharmacist to see if there are alternatives that may let you be less anxious. Now, there's another group of medications. These are prescription, again, but they definitely cause anxiety-like symptoms and sensations for many people, and this is the antidepressants. Like stimulants, antidepressants work in your brain to change the levels of chemical messengers that we call neurotransmitters. And so some examples of antidepressants, for some of you out there who are not familiar with a lot of the medications, it would be things like Celexa, Prozac, Lexapro, Paxil, Zoloft, Effexor, Cymbalta, Pristiq. Actually, the list is so long, I am not going to read it all, but these antidepressants are often prescribed to treat both depression and anxiety, but they can lead to nervousness or anxiety as a side effect. It is listed as a side effect. Of course, it seems contradictory that a medication used to treat anxiety can also cause anxiety. I totally agree. Yes. And it is because serotonin can attach to multiple receptors through the brain and body. and there is a risk of causing unintended mood changes. So this opens up a bigger question about these drugs, but the focus today is on the ones that are causing anxiety. And so if you are on any of these, this is great conversation with your physician. I have had many one-on-one clients that have had these reactions to these antidepressants. And it's important for you to know that you are eliminating things that could be causing you anxiety and then dealing with what's left. We don't want to be putting things on top of our already anxious nervous system and adding more things. We'll never find our way out if we are taking things that are causing us to feel anxious. It's hard to look at, I know, but it's a great place to look at because you're going to find another way around it. Now, you may be on these things and they don't bother you, but if you are really wondering where your last bits of anxiety are coming from, you have worked on the way you are thinking, you have worked on so many of the other pieces of being able to calm your nervous system and be there with the stress and not let it set you off, you may want to be looking at things you are ingesting. And today we were only talking about medications, common medications. There's probably other ones out there. As a matter of fact, there are. But first, I want to tell you to report to your healthcare provider any mood or behavior changes after starting those antidepressant medications, including any anxiety symptoms and sensations that come up for you. It is important for them to know that so that they can help you. Other medications that have been found to trigger anxiety include things like thyroid medications, beta blockers, benzodiazepines, antipsychotics, migraine medications, and pain relievers, even like ibuprofen, naproxen, and others, may make some people anxious or drowsy or affect their concentration. It is very important to be aware of the potential side effects of medications and talk to your doctor if you experience any anxiety symptoms or sensations. Again, this is great conversation to have with your physician and or your pharmacist. You may be able to get great relief from removing any of the anxiety culprits. I hope this show has been helpful for you, and I hope that if you have a question or a topic that you will be like our listener Karen and send me a voicemail from the website or send me an email, anxietycoachespodcast@gmail.com. And now for today's quote. Before you heal someone, ask him if he's willing to give up the things that made him sick. And that's from Hippocrates. I'll be back in a few more days with another podcast. Until then, be well and aloha.
Thanks so much for joining us for today's episode of the Anxiety Coaches Podcast. Find more information at theanxietycoachespodcast.com.